Welcome to the Omni Dental and Med Spa podcast. Today, we're doing a deep dive into something really, really important for anyone who has dental implants or maybe is thinking about getting them. We're talking about the brand new 2025 implant maintenance guidelines.
Yeah, and these aren't just small tweaks. They're actually a pretty big shift in how we approach implant care. The whole idea is to seriously bring down failure rates.
That's exactly. And here at Omni Dental and Med Spa, we're located at 305E Rand Road in Arlington Heights, Illinois. We're really committed to bringing these, cutting-edge strategies right to our patients.
That's absolutely right. Our practice, which Dr. Billis Poles leads, is really dedicated to excellence. That means general dentistry, but also advanced stuff like dental implants, plus a whole range of aesthetic services. And we're really proud to serve Arlington Heights, but also the nearby communities. Places like Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows, Schaumburg, Wheeling, Des Plaines, Elk Grove Village, too, making sure everyone gets top-notch care.
So, you've decided to invest in your smile with dental implants. They're amazing, right? They've totally changed restorative dentistry, so stable, they look so natural.
Game changer.
But like any big investment, especially in your health, you got to look after them. They need careful, ongoing upkeep. So today, we're going to unpack exactly what that careful upkeep looks like now, especially with these new 2025 guidelines. Okay, let's start with the basics. We hear all the time how successful implants are, and they really are, high success rates.
Yeah.
But what happens if that maintenance, that crucial part, isn't done properly? What are the risks we're actually trying to head off?
Yeah, that's a really key question. The main things we're trying to prevent are conditions called peri-implant mucositis and peri-implantitis.
Okay.
Think of them as sort of the implant equivalent of gum disease,
Right.
but maybe with more serious outcomes potentially.
Right.
Peri-implant mucositis, that's inflammation just in the soft tissues, the gums around the implant. It's reversible if you catch it early.
Okay, so that's the less scary one.
Well, yeah, but if you don't deal with it, it can progress to peri-implantitis, and that's much more aggressive. Now you're not just talking inflammation, you're talking actual bone loss around the implant, irreversible bone loss.
Ah, okay, and that bone is what holds the implant stable, right?
Exactly. If that supporting bone erodes too much, the implant can get loose and, yeah, unfortunately, it can fail completely.
So peri-implantitis is really the big concern then, where the damage is permanent. Are some people more likely to get these problems, even if they're trying to keep things clean?
Absolutely. Yeah, maintenance is key for everyone, but some folks definitely face higher risks. For instance, patients who consistently struggle with their oral hygiene, just aren't managing thorough daily cleaning. They're at a much higher risk.
Makes sense.
Smoking is another really big one. It messes with healing, impacts the immune response.
Yeah.
Makes the tissues around the implant just more vulnerable. And uncontrolled diabetes, that's also a major concern. It affects blood flow, the body's ability to fight off infection. It's a significant factor. There was a big systematic review that basically hammered this home. Regular maintenance and optimal oral hygiene are critical in preventing and managing peri-implant mucositis.
Wow.
Yeah. It just shows, we have this amazing technology, but the patient's role, their commitment to daily care, understanding these risks, that really makes a huge difference in whether that implant lasts. A measurable difference.
Okay, so that takes us right into these new guidelines. What are dental professionals now recommending for that routine care? And what's this 3-month rule that people are talking about? What's the big change?
Right. The shift to 3-month recall intervals isn't just arbitrary. It's especially important in that first year after the implant goes in. There's some really compelling new data, longitudinal studies showing that the very early stages of biofilm buildup and inflammation, if you let those go, even just a few extra weeks past that 3-month mark, it kind of snowballs. It significantly bumps up the long-term failure risk.
Ah, I see. So it's about catching things super early.
Exactly. Proactive interception. We're hitting that precise biological window where we can have the biggest preventative impact. It's a real step up from older approaches, which were often more reactive, maybe seeing patients less often.
Okay.
And this whole structured approach, it's formally called SPI, Structured Supportive Peri-Implant Care.
SPI. Got it.
The structured part is important. It means each visit follows a precise, evidence-based plan. Rigorous cleaning, checking for specific early warning signs, and detailed X-ray monitoring. Now, some really low-risk patients, maybe they can stretch it to 4 or 6 months later on once things are stable. But for most people, that 3-month cycle offers the best protection. Catches problems when they're small and manageable.
That makes total sense. Gets it small.
Yeah.
So how do X-rays, the radiographic evaluations, fit into this more intense schedule?
Radiographs are absolutely critical. They let us see early bone loss, often way before you'd feel anything or see any obvious signs. So a baseline radiograph is essential. Think of it like the definitive before picture of the implant. But crucially, it's taken after the final crown is on and everything's settled in.
Right, the finished product.
Exactly. That image becomes our reference point. Years later, we can compare back and spot even tiny changes in bone level. Then, we typically recommend annual X-rays periapical or bite wing to check the crestal bone level. That's the bone right at the top of the implant, its main anchor point.
Okay.
Even losing a tiny bit there can signal trouble. And if those standard X-rays hint at something, or we just need a better look, we can use cone beam CT or CBCT. That gives us an incredible 3D view.
Like moving from a flat map to a 3D model.
Exactly, a full 3D picture of the implant and the bone around it. It gives us a crystal clear view of any developing issues, lets us plan interventions much more precisely.
Okay, so imaging is key. What else happens during these frequent maintenance visits? What is a hygienist actually checking for clinically?
Well, they meticulously check several things. Implant mobility is a big one. Now, sometimes a crown might feel a bit loose. That's different. But if the implant itself is moving, that's a serious red flag. Possible failure.
Yikes. Huh.
They also check for bleeding when they gently probe around the implant. That's a key sign of inflammation. And they measure the pocket depth around the implant. Deeper pockets can mean bacteria are building up, maybe some bone loss starting. And another thing that's getting a lot more attention in the new guidelines is proper occlusal evaluation.
Occlusal, that's your bite, right?
Yeah.
How does your bite affect an implant? They seem so solid.
Precisely. It's fascinating, actually. Natural teeth have something called a periodontal ligament.
Okay.
Think of it like a tiny shock absorber around the root. It allows the tooth to flex just a microscopic amount under pressure.
Ah, okay. Like suspension.
Kind of, but an implant is fused rigidly to the bone. It's like a post set in concrete, no give.
Solid.
Which means forces like grinding or clenching, that's called bruxism, or even just a misaligned bite, those forces go directly to the implant, like hitting it with a tiny hammer over and over.
Ouch. I can see how that would be bad.
Yeah, over time it can lead to mechanical failures like fractures of the implant or the crown on top, or it can contribute to bone loss around the implant.
So what's the recommendation then?
That's why recent studies are strongly recommending occlusal night guards for patients who grind or clench. It's a really significant preventative step. Protects that implant bone connection from those damaging forces.
Wow. Okay. So the professional visits sound super comprehensive, from x-rays to bite checks. But thinking about prevention, it's not just the visits, is it? What about the tools the hygienists use? Are they different now, too?
Oh, absolutely. That's a crucial point and a major difference compared to cleaning natural teeth. Implants need specialized tools. You can't just use the regular metal instruments.
Why not?
Because the implant surface, usually titanium, is actually quite soft compared to tooth enamel. It can be easily scratched by standard metal scalers.
Okay.
And those tiny scratches, they become perfect little hiding places for bacteria, makes the implant way more prone to infection and disease.
Ah, I see. So you need special, gentler tools.
Exactly. The evidence-based recommendations are really specific now, like air polishing with special powders, glycine or erythritol powder, that's considered the gold standard. It gently removes the biofilm, reduces pocket depth, and studies show it works better than old-school scraping because it doesn't scratch.
Okay, air polishing. What else?
Also, ultrasonic scalers, but, and this is key, they use special tips made of plastic or something called PEEK.
Teak.
Yeah, it's a high-performance plastic, super durable, but softer than metal. It cleans effectively without causing those micro-scratches. And if hand instruments have to be used, they should be made of titanium or carbon fiber, materials compatible with the implant itself to avoid scratching or contamination. A recent clinical trial really drove this home. It confirmed that air polishing and these specialized ultrasonic scalers significantly outperform even plastic hand scalers in controlling peri-implant problems. It really highlights why these specific tools matter so much.
That's a huge difference, yeah, realizing how vulnerable that surface is. Okay, so professional care is advanced, specialized tools. But what about the patient? What's our role in all this? What are the essential home care routines in these new guidelines?
The patient's role is absolutely massive. You know, the long-term success of implants depends just as much on daily habits as it does on professional care. It's a real partnership.
Okay.
So at Omni Dental, Every single hygiene visit reinforces those critical home care techniques. We're talking diligent use of a soft bristled toothbrush, making sure you're getting right down to the gum line around the implant, and cleaning between the teeth or around the implant is non-negotiable.
Flossing.
Yeah, specialized floss or interdental brushes, sometimes little tufted brushes designed for those tricky spots around implant crowns. We make sure patients know exactly how to use the right tools effectively for their specific situation.
It really sounds like patients have a big part to play.
Yeah.
You can have the best care in the office, but if you don't do the homework.
That's a perfect analogy. You've got to practice daily. We often see patients, maybe they feel a bit overwhelmed at first, thinking it's just more brushing. But once they really get consistent with the specific techniques, especially combining them with some of the newer recommendations, they see the difference. At their checkups, there's less bleeding, the tissue looks healthier. That's usually the aha moment. It stops being a chore and becomes, a commitment.
What are the newer recommendations for home care?
A really significant one, strongly pushed in the 2025 guidelines, is using water flossers, especially with antimicrobial rinses like chlorhexidine mixed in.
Water flossers, okay, like a water pick.
Exactly. A recent study just this year found using a water flosser with chlorhexidine significantly reduced inflammation around implants compared to just using water alone. It's thought to work by getting that antiseptic effectively under the gum line and disrupting the bad bacteria, the biofilm.
That sounds powerful. Any downsides?
Well, we do need to counsel patients. Long-term chlorhexidine use can sometimes cause a bit of mucosal irritation or staining between the teeth. So we make sure people understand how and when to use it properly. It's not usually an everyday forever thing.
Got it. Good to know. What about people with really extensive work, like a full arch of teeth on implants or those all-on-4 cases? Is home care different for them?
Oh, absolutely. Those cases often need really customized maintenance plans. Think about it. You have a whole bridge fixed onto multiple implants. That structure can create some intricate spaces, little nooks and crannies where plaque and food can get trapped. Access can be trickier.
Yeah, I can picture that.
So these patients usually need more advanced cleaning aids, maybe specific brushes angled just right, or special irrigators to flush things out. And often they need even more frequent professional cleanings because of that complexity. Our hygienists are really skilled at tailoring the advice, finding what works best for each person, balancing effectiveness with what's actually practical for them to do every day. We want them to feel confident they can manage it.
It really does sound like a team effort. Patient, hygienist, dentist, all working together. How does Omnidental make that team approach work?
Well, there was a big consensus recently among dental experts, and they basically said the best way to prevent that serious, irreversible peri-implantitis is through effective professional supportive care and early intervention for mucositis, catching things early.
Right. Stop the reversible stage from becoming irreversible.
Exactly. So at Omnidental, we fully embrace that collaborative model. Hygienists, dentists, and the patient, you are all part of one team. It starts with a really thorough risk assessment for every single patient, understanding your specific situation. Then comes the education and motivation, giving you the knowledge, the tools, the techniques, so you can be an active player in your own health.
Empowering the patient.
Precisely. And finally, it's about those regular, structured checkups, constantly tweaking your personalized maintenance plan as needed. When patients truly understand that implants need lifelong, proactive care, they're much more likely to commit. They see themselves as crucial to the success. It's not just us fixing problems, it's building a partnership for long-term health.
Okay, so pulling all this together, what's the main message for our listeners, whether they have implants now or are maybe thinking about them?
I think the key takeaway is this. Dental implants are an incredible solution. They restore your smile, your ability to eat comfortably. They're amazing. And they represent a significant commitment health-wise and often financially, too.
Right, an investment.
Absolutely. But without that dedicated, proper maintenance, that whole investment is at risk. By really following these latest 2025 guidelines, the professional cleanings, the specific tools, the customized home care, the regular checks with advanced imaging, patients can genuinely enjoy decades of healthy, functional, beautiful smiles. It's all about protecting that investment, making sure it performs for the long haul.
So the bottom line is clear then. Dental implants are absolutely not a set it and forget it kind of deal. They need ongoing, personalized, proactive care to really thrive and deliver what they promise.
Which leads to a pretty important thought, doesn't it? What if just understanding and actually doing these new proactive maintenance steps could totally change your long-term oral health? Preventing those silent problems before they escalate, making sure that smile you invested in truly lasts a lifetime, giving you real peace of mind.
Protecting your smile investment is absolutely key. In OmniDental, we're really proud to bring these latest science-backed strategies for implant care right here to Arlington Heights and the surrounding areas. So if you're maybe a bit unsure about your current implant care plan, or if you're considering implants and want to start off on the right foot, now is definitely the time. Schedule a professional evaluation. Let's get a plan in place to protect your oral health. You can contact OmniDental in Arlington Heights today. Just call 847-483-8833 to schedule your personalized implant maintenance consultation or just to learn more. We are genuinely looking forward to helping you achieve and maintain a lifetime of great oral health.